The first presenter is called Aloysius Ssennyonjo, and he's going to talk about governing multisectoral action for health. What are we learning from the social science theories?
Thank you, Prof, for the introduction. My presentation is about how can we enhance coordination of multisectoral action and trying to draw from theories where this concept has been studied over time. So the background has been provided since we came here that to achieve health benefits, we need to look at investments in a range of areas beyond health. So how do we get other sectors to work together is a question that I'm interested in. From my work, I have noted that big organizations and government inclusive have a challenge of coordination because of different departments, different mandates, different cultures, and these in a way constrain the ability to coordinate. So what we see are inefficiencies, we see costs increasing, and we see difficulties in achieving interdependent outcomes. In my work, I've also noted that there have been some efforts to coordinate by taking on structures and processes. Structures at different levels. For example, when you look at government, at cabinet level, at the sectoral level, at intersectoral level, there are structures like technical working groups, task forces. All these are efforts to coordinate that kind of intersectoral dependence. But also we see processes that are important for coordination. The budgeting and planning process is another area for coordination. Evaluation of programs, regulatory reviews in some settings. For example, in Uganda, before you start a new policy, there's what we call a regulatory impact assessment to see how the new policy interacts with the other existing policies. These are efforts to coordinate at that level. So what is motivating my work is that when you look at public health attempts to multisectoral collaboration, there have been little effort to draw on domains of science where this area has been developed in depth and studied in a more elaborative way. So I take work from social science theories to understand the drivers and evolutions of the coordination mechanisms to enhance multisectoral efforts. We have two classes of theories that I have been able to find out and study in detail. Two are economic-based, and then we have those that speak more to the political process. So we have economic-based theories and politically oriented theories. The economic-based theories are transaction cost economics, agency-based theories. The politically oriented theories have resource dependence theories and political economy perspectives. So what I did is to find out what are the central propositions from these theories and what do they mean for coordination. So the transaction cost economics theory looks at the considerations of costs in managing relationships as the central driver for coordination. And it takes actors to be willing to minimize costs of their interaction with other actors as the main motivation for their coordination. The agency theories, on the other hand, look at relationships between sets of actors, one known as the principal, whose interest is to see their interests achieved through another actor called the agent. These two are all opportunistic, but to govern that relationship, you need contracts that generate incentives for them to be able to coordinate. So the main driver there is incentives and contracts as a mechanism of coordination. Now what we see from this work is that these theories do not take into consideration the influence of the context in which actors find themselves. So the more politically oriented theories help us in that realm. So in respect to the resource dependence, the main driver of coordination is the consideration of the costs that actors don't have within their own organizations. So they engage in relationships to control resources that are owned by other actors. So it is an aspect of controlling resources that you don't have so that you have more certainty about what you need in case you need it in a foreseeable future. The fourth perspective, the political economy perspective, looks at the politics. What is the influence of ideas? What is the influence of values? What is the influence of institutions and norms and cultures that people find themselves in? And the influence is that these create a situation of contestation and negotiation that is not a very clear and straightforward process. So there is complexity and dynamism in the interactions. As I try to summarize, from these theories we note that from the political economy, coordination is a result of a political process where there is contestation and negotiation of ideas, resources, and interests. So we need to pay attention to these as we design collaborative initiatives. Whereas the transaction cost economics tells us that we need to be aware of the costs of managing these relationships as people interact with other actors. Is it easier to make the service internally or to outsource? Because that relationship has to be monitored, and in a way that brings costs in terms of time, resources, and human resources, and other kinds of costs. We have to be aware of the issue of incentives and contracts as mechanisms to drive coordination. And the last consideration is that we need to be aware of interdependencies as the main driver of coordination. These are summarized in 6 elements that I want to bring to our attention. One is the necessity. Is coordination considered a necessity? Is coordination a result of a need to control the other actor? Is coordination a result of the need to see mutual dependencies handled in a more beneficial way? Is it a need to minimize costs and maximize efficiency? Is it a concern about stability and certainty? Or is it an effort to achieve legitimacy so that you find yourself considered to be normal like others? And in final reflections, we need to be aware that coordination is a multidimensional concept. We need to draw on these multiple perspectives to understand how we should design our collaborative efforts. But also public health literature and practice should draw on these theories to ensure that our coordination efforts are rooted in these theoretical perspectives that explain the phenomenon of coordination. Thank you so much.